This meeting is being recorded.
Thank you very much, Judith. So welcome CUH friends, colleagues and allies. My name is Tracy Cripps and I co-chair the REACH network with my colleague Emil Brown. For those of you who don't know, the REACH network is our recently rebranded network from BAME to REACH, which is our Race, Equality and Cultural Heritage Network. And we had our inaugural launch last week, Thursday, which was a really inspiring event. So thank you again to all of you who participated in that. So as part of our celebrations for Black History Month, we, the REACH Network, have put on an inspiring programme of virtual presentations for you all to share and enjoy and learn and be inspired from. And those presentations we've put on in line with the key themes for Black History Month 2022, which are Action Not Words, Time for Change, and Black Health and Wellness. And so I am absolutely delighted today to bring you a presentation from Tendai Nzirawa, who will be talking to us today about challenging the narrative in addressing inequalities within maternity and neonatal services. And this will be the very first of these virtual presentations. So Tendai is an inspirational speaker and we can't wait to hear what she has to say, but I think it's really appropriate I give her the introduction that is due. So Tendai is the Maternity Clinical Improvement Lead for Eastern Academic Health Science Network. Tendai is also the regional lead for the East of England Neonatal Nurses Association, and she also chairs the Paediatric Pain London Oxygen Group. Tendai has been a finalist of the Prince of Wales Award for Integrated Approaches to Care and has won many other awards and written publications that have informed national guidelines. So Tendai, you are extremely welcome here today in the first of these virtual presentations. And without any further ado, Tendai, I give you the floor. Welcome.
Thank you, Tracy, and good morning, everyone. Thank you. Yeah, it's always interesting when you hear the amount of things that has happened in the background, but you know, it's all been key to lots of collaboration and working together with so many people. So as you said this morning, I will be sharing what the work we've been doing as well with the maternity and neonates. So I'm just going to share my screen, make it much.
And while you're doing that, if I can just quickly mention to everybody that's participating in the session today, that we want this to be an interactive session and people can submit questions through the Q&A, I think Judith mentioned to me, and also on Facebook. So if you've got any questions for Tendai, please do submit them. We want this to be an interactive session and we can address them at the end. Sorry about that, Tendai, please go ahead.
No, that's fine. Thank you again, Tracy. So as Tracy has highlighted, I will be sharing about what we've done the past few years with the maternity and neonates. I think I'll always start by talking about how COVID really, we knew that there were lots of health inequalities, there were inequalities that were happening and they've been highlighted through many documents and through many reports and articles and findings the past couple of years. But actually COVID was one of the things that sort of prompted everybody to start realizing that actually we could do better, we could take more action, we could actually challenge ourselves to talk about it a bit more, and not only about health inequalities, but also talk about racism and discrimination and many other things. So hence this work has been sort of a big drive and a big passion for me, probably the past 3 to 4 years. So I'll start. So I'm going to do a two-part. So I'm going to talk about briefly about the women or birthing people in as a focus, or we could say parents as well, because when I'm talking about neonates as well. And then I'll do another part where I'll focus as well on staff, because I think part of neonates and maternity is you can't just focus on one element and not actually focus on the other. So they need to be working together. There needs to be that we are looking at both the women, the birthing people, their families as well, and the staff as well that are supporting them. So what we know that actually Black, Asian, and ethnic minorities, especially as well mixed race ethnic minorities, and most deprived suffer the worst clinical outcomes and health inequalities within maternity. So I'm focusing on maternity. We know that's where we're finding the worst outcomes. And then we've got as well women with complex factors as well. So these are the ones that have suffered or suffering domestic violence, non-English speaking women, teenagers, and as well substance misuse and many other migrants, asylum seekers. They also suffer, health inequalities and inequalities within our maternity and neonatal units. And this is already a document that supports that. So we got the NICE guidance, the CG 110, that actually highlights all these key complex factors women. So we know that our mortality and morbidity for our Black and Asian women as well is the one that we see, the data that has been highlighted the past couple of years, especially with our Embrace reports, with COVID and many other reports that has been highlighted. And that leads as well, when they experience that poor maternity, journey, most of them, if they do survive the woman, some of them have poor outcomes where they have stillbirth. And this week actually is, we're actually remembering stillbirth, miscarriages, and neonatal deaths. So this is a week where we are actually, waving a wave of light as a memory for those that have lost their babies. So we know it's quite a sensitive area to talk about, but actually we still need to remember and be there to reassure people. So we know that the stillbirth rates are higher. So what we know is Black women are 5 times more likely to have a poor maternity outcome. So it might be maternity or neonatal. And we know the Asian are 2 times, or mixed race are 2 times, and Asian almost twice. So there's been reports. So we've had the birthright reports that has come out this year. We've got 5 times report, invisible reports. There's been many reports highlighting the same thing. And nearly every time these reports come out, one of the themes that keeps on coming out is systematic racism, discrimination, issues of not being listened to, communication challenges. And it's time and time again, the themes are nearly the same. And that is quite sad to know that different reports that have been done by different organizations, different individuals, still highlight more or less the same thing. And some of it as well that has been found was actually the education curriculum has not been updated to meet what is currently happening, the diversity we have in our community. We still have books, we still have textbooks or PowerPoint presentations that represent only white compared to representing the diversity that we have within our community. So sometimes within maternity, just simply having to understand the different types of rashes on different skins can be very challenging because what you see in a textbook is not what you see in your community. So that has been highlighted that our education in our curriculum now needs to be updated to actually represent the population and the diversity we have within our community. So what have we been doing about it? So last year, as part of NHS England, they funded a program which was cultural awareness. So it was actually focusing on supporting and educating individuals in our systems about actually what cultures do we have in the east of England? Who are they? And what do we need to do? Just hearing first line from community leaders or community groups or people that have got the lived experience, have got the expertise to share that, to actually share that information. So we had last year, so this actually started in 2021 around April time, and we had LGBTQ plus as well sharing about the experiences and as well the health inequalities they experience within maternity, African communities, orthodontics Jewish community. We're having an influx around South End area. So actually we're having that shifting where we need to know how do we support those women? Why do they do certain things? Why do they prefer this? So we had them actually sharing, and people with the expertise from their community coming to explain to us. And things that I actually picked up from that was simple things like our communication. We always like to do leaflets, we like to send emails, we like to put out things on social media, but actually some communities, they are not allowed to access certain things. It has to go through their comms teams within their community, and they have to approve to ensure that it is actually meeting a certain standard for them to look at and for their children to look at if they do end up coming across it. So actually, all these things are things that you don't think about when you do a poster, when you share an email, when you share something on social media, is actually who are you trying to focus on? Who is going to be the one that you think is going to look at it? Because we always assume that it's going to go to everybody, but not always. And then we've had the Roma community and as well, we had Eastern European communities, Muslim, South Asian community, as well sharing the experience, and Gypsy and travelers. In actual fact, the Gypsy and travelers experience one of the worst maternity outcomes than the Black, the Asian, and mixed race. And it's so sad to know that, and what are we doing about it? What do we do to support? And there's lots of work happening actually in Cambridge and Peterborough around supporting. They've got a specialist health visiting team that are now supporting that area and seeing the work they're doing and how they're doing it, how they're supporting their community was very interesting. So what we did with that information that we gathered from those virtual workshops that we did and working closely, as you can see, with local government authority, is then we then put it all together into a report with the findings, with the feedback and everything. So the links is there. I will share that you can have access with that. And then we put that together, and that's been useful to actually highlight all in detail the information about what things to consider, about food, about languages, about so many other things, and most importantly, about interpreting service. I think we need to really push on that we cannot continue using friends and family members to interpret, especially when things are so sensitive, either it's a loss or a woman is about to go into theaters or many other information. We need to ensure we're using the right services to support women and actually reassure, especially we know with our refugees and our migrants, sometimes they refuse or they are actually afraid to access certain services within maternity because they know that they might put themselves at risk. If they have any costs that are higher than £500 and they can't afford to pay it, that could affect the application with the Home Office. And actually, we don't realize that because we keep on pushing. There's been lots of documentation, lots of reports to support them to say they shouldn't be charged. But we know that sometimes things take a bit slower to get change within policy, within systems. So the fear is still there. And how do we reassure them? So the other thing we did is actually respond to that was we did a face-to-face this year because some of the feedback when we're doing during COVID, the virtual cultural awareness was actually, we now want to network. We want to see each other. We want to talk to each other. We want to share ideas. And so what we did, we actually did that. We responded to the feedback on the evaluation and did a face-to-face in July this year in West Suffolk. And about 89 delegates attended, which was good because it was just before the hottest day that we had in July. So we were thinking nobody might end up turning up because it was just so hot, but people still turned up. And as you can see, we had so many organizations coming together to present, to do workshops. So to us, that was really brilliant because we were able to learn lots of information, learn what needs to be done from an academic point of view, because as you can see, we had Anglia Ruskin University, from a service user lived experience. So we had the Luton Roma Trust there, we had a maternity sanctuary as well there, we had the Bliss Baby Charity, we had Parents First as well, and we had the Outhouse, which is about LGBT. So we were having so much organization, individuals sharing, giving us knowledge that people were able to take back and actually say, what do we do with it? And some were making contacts as well that they were able to continue the work within their local areas. I just thought to just briefly highlight all what's been happening. So as we say, the theme is about taking action and no more just talking about words. And we are seeing that in real action within maternity and neonates. And I just thought to highlight, as you can see, Milton Keynes has already done a recruitment of an ethnic minority to support international recruits, because again, they need extra support. They're changing an environment, that cultural awareness, cultural competency, for them to understand the environment they're coming into, but also for people that are living in this country, is for them to also give that culture curiosity of the people that are coming into their country, sharing your knowledge about, actually we like fish and chips on a Friday, sometimes that's little things that people learn, and it's fun to share, but it's exciting to give that information and asking them questions about their culture and how you can bring them into your community, into your organization, into your teams when you're working with them within a clinical or community setting, so that they have a feeling of belonging. Because that is what is key. When you leave your home and go and start a new life in another country, you want to feel like you're part of that place. You want to feel that feeling of belonging. And as you can see, NELFT has done as well, recruited somebody as well to support similar thing. Princess Alexandra looking into things like jaundice as well, how to make sure you're diagnosing your Black and Asian babies. They don't get that mixed diagnosis. We've had as well Lister Hospital doing some work again, they got two cultural inclusive and equality ambassadors that are leading and doing lots of work within Lister Hospital. And as you can see, Suffolk and Northeast Essex local maternity neonatal system are actually launching some videos. They're doing the launch next week on Tuesday. So they got a launching in Colchester that we're so excited, because they've done videos on it's okay to ask. It's okay to ask. It's okay to ask, about questions that you feel very uncomfortable to. So they're doing a launch next week. I'm happy to share the contact of the person that's organizing, but we're so excited to hear the work they've done. And they've reached out to many community groups within their area to do that. And then in Cambridge and Peterborough, we've been doing so much great work as well. As you can see, you've had, looking at clinical priorities, you've done as well digital inclusion work, and then you've got the Ryan project as well, being led by one of your midwives. It's taken off, and she's been involved in a lot of regional and national work. So I think there's so much work, there's so much action being taken. And I think people are shifting, not, from those words, from just putting an action plan and putting it in the cupboard or storing it on your drive, to actually taking it and utilizing it. And I'm so excited for what the future holds. So I did say that I wanted to highlight about staff, and then I'll open it up for those questions and discussions. But I thought, one of the things we realized when we're doing so much work running with about focusing on women, service users, and our birthing people, we then realized that we were not really putting a deep dive on what is happening within our staff within maternity and neonates. So last year around June, July, we did a survey to actually then find out what's the experience. And then we started a working group in November. So I'm going to share that as well. So we know already our workforce and race data in relation to, our, where our representation of our staff is. And as you can see already, your Black and ethnic minority, once it gets from band 5, and you can see band 6, it starts going down. Band 7, it gets lower and lower. This is all data, as you can see, from 2021, but it's still representing what we still see right now when you're going in a clinical community setting. And things are changing, but there's still lots of work to be done. So as I said, so we did the survey, we sent it out. We had about 89 responses within our region, focusing on maternity and neonates. As you can see, we asked about ethnicity so that we know. We had a higher response from our Asian Indian community and our white colleagues, and a few from different ethnic groups, as you can see. And then we also asked the banding as well. I think you could see the highest number of staff that completed were band 6, band 5, and band 7. And then we had medical staff as well, consultants completing this. And our lowest number of staff that completed it, as you can see, and some we didn't even see any representation at band 8, D, and 9. But our lowest numbers, you could see band 8A was only 3, band 8B was only 2. That already started giving us some alarm bells that actually our data was not much different from what we saw with our workforce and race equality standard data. Then we asked, what do you feel about how are you progressing fairly well within your career? At least 64 said yes, so that was reassuring, and 13 said no. And some have said they were trying but no success. Some were not even sure how to progress. And that is quite sad that still in this time, people still don't have access to that information. And there's so much development programs that are being developed. And some, even if they have access, it's not always offered to them first. The shortlisting is not always fair enough for them to even go through. And some were even saying if they do try, they've tried, to get jobs. And one even stated 10 times they have tried. And you start asking the questions. If somebody is putting an application 10 times and you're the line manager, what can you do to start supporting them? And I think we need to start asking those questions. What's the conversations happening during appraisals? What are we taking from them? How are we moving from just a conversation and documenting and coming back 6 months or 12 months later and still doing the same thing and still having the same outcomes? So we then ask, what are the barriers for your, that you think is, stopping you having your career progression? Some were even highlighting just their name and color they thought was the barrier. So which is quite sad that people already felt because of their name, because of their color, they thought that is the first thing will be a hindrance from them getting forward. Some, the lack of Black and Asian staff in senior positions, some institutional racism, some the panel members not being diverse, some no support to even prepare for the interviews, the lack of experience in management and senior roles, those stretched opportunities, the part-time, if you choose to go part-time because of childcare or many other reasons or carer commitments, then you're not having the opportunity to be offered that job, the lack of mentoring and coaching, the feeling like an outsider. And that is quite sad that in a team, in a unit where you're supposed to be working as a collective to support your staff, to support your patients, your service users, where some don't feel they're even part of that team, they don't feel belonging within that organization. And the lack of confidence because of their language, their accent, feeling unable to express themselves enough. And you see that time and time again where you've got certain staff that are so quiet in certain conversations, and they feel that they're being brushed off for one reason or another. And I will just touch, so we also then thought, actually, we've done this data. So we looked at the data for the workforce and race data. So we looked at our survey data. We said there must be more data. I think we were trying to convince ourselves that maybe what we are seeing is just not enough. So let's look for more data to convince ourselves that we are definitely doing what we think we need to do in taking action. So we asked Health Education England to share some data as well with us. And they did. So their data, and it wasn't far from what we already had, and actually highlighting more or less similar things. Again, more representation within midwifery, neonate. So we looked across our professionals, and you could see more of our workforce is white, except for medics, which had more Asian. And then again, we looked at ICS level. So we broke it down from, BLMK, Cambridge and Peterborough, Herts and West Essex. And again, you can see the green highlighting again the most. So you start asking yourself questions. Okay, so some areas had more, that diversity, but actually the workforce is not representing that. And then we broke it down to registered midwives. Again, when you saw in band 8, it was hardly, because if it was less than 5, there wasn't much, it was not being able to show on the graphs, and some was not even stated. So we know there's work about people highlighting with their employee documents is actually highlighting their ethnicity, and some choose not to for one reason or another. So we've been encouraging that as well. And then you can see neonates again, nearly similar thing that we were seeing. It just was the same picture coming through nearly in different organizations, different data. And then I think you can see where this is going. So there's a few slides. So what we did is we then sat down, looked at what we know. So we are part of, we represent maternity and neonates in the Chief Nursing Officer, Chief Midwifery Officer, as Ethnic Minority Strategic Advisory Group. So we looked, what is the national objectives? And then we looked at what are our regional objectives from that organization and that group. And then we looked at our objectives as a working group, how we can link that, because we don't want to do work that we'll be doing, it doesn't align with what other work that is happening from a regional and national point of view. There might be some few elements that we can add, but we really thought alignment is important, because if we don't, it's going to confuse everybody. So hence we started doing some alignment, we looked and we set our own objectives. I won't go into detail because there's a few of them on there. So we identified through that, who needs the support. So we broke it down based on our data. And then we could look, where are the data? Where can we find that? As you can see, we already had our HE data. Neonates are now doing some work on that. What data as well from a local authority. So we reached out as well to our public health, and that's changed as well to Office of Disparities. So we were looking at all the places that we can think we can find data so that we can embed it into that. We've also reached out to our NMC, the Nursing and Midwifery Council, as well into the data, because we want to compare that data with the workforce and rate data about referrals to the NMC. So, and what are the themes and what are the outcomes as well. So from that, we then developed a driver diagram and then actually drill down based on all that data. What is it? So what was our aim? So we then set an aim for our working group, and then how we're going to move forward, and what are the secondary drivers. So what we want to focus on is the cultural awareness, a feeling of belonging, so health and well-being, coaching and mentoring, and leadership. So we were looking at all that data and saying, how do we shift it now from just being data to start doing something about it? So we then said, what are we hoping to achieve when we do all this work? So we want our freedom to speak up, because we know bullying and harassment and that not feeling of belonging, institutional racism being highlighted. And then we also thought, okay, we want some action learning sets so that they can develop their career pathway, because some were saying we're trying and things were not succeeding. We want to now empower the ethnic minority staff, boost their confidence a bit more, because I think if you've been rejected a few times, you've applied time and time for a job, your confidence starts going down. And we want to just do that. So how to write those personal statements? What are the little things, nudges that could be supported? Attending interviews, that visual transformation into leadership roles. And then again, increase the ethnic minority representation at band 7 and above, because we saw from our data that is not what is in neonates and maternity. So we need to do that. And then work on to, anti-racism workshops. What can we do? Work with Harpreet and her team, around what she's done already, because there's already work that's been done. We sit on the EDI network, group, so that we can actually embed the information and utilize it within our area. So from that, we started a working group, and we've got a consultant obstetrician that is leading that. And we had a deputy chief midwife. Unfortunately, she just left NHS England, but we've got somebody starting in November. So our chief midwife, Wendy, is stepping in while they recruited for that. And then what we've done is we then did a task and finish group, because we thought that actually if people are developing these roles to support international recruits, we need a job description that will be utilized across the trusts or across the systems. So we did a task and finish group. So we've done that. So we've now got a job description, we've circulated it, we've shared it with the national team. So we're just trying to push it for job matching. And some of the LMNS are actually now working on it and going through their HR to actually do that job matching and utilize it, so that we can actually have a more of a uniform job description than having so much variation across the board. So that's been done. So now we've also developed a program, which we are hoping to start sometime in February next year. We had hoped to start September, but there's been challenges with funding. We know there's not much money, but we are hoping to get funding and secure funding. And it will be a 6-month program, and it will be focusing as an MDT approach for our Band 5s and Band 6 midwives and neonatal nurses of ethnic minority and middle grade doctors, because we know from our data, again, that's a lack of representation at consultant level in specialist roles. So we are working with so many other organizations, our Chief Midwifery Officer group at a national role. We are working with our local maternity and neonatal systems, universities, our Royal College of Midwifery, and again, the head of Health Education England, and again, EDI head, Hapri, and the team. And our neonatal colleagues are actually doing survey as well, because they're also now trying to deep dive on what they can move forward on supporting some of the work as well. So yes, I think I just put that just to highlight, as you know, the anti-racism strategy was done and published, and Hapri and her team did lots of work on that. And we've done all we can as part of this work is ensure that we don't forget that part of the challenges why people have not got to that Band 7 and above, why they've not had strict opportunities, why they've not had the secondments, is actually biggest factor is racism. And what we're trying to shift now is move from that and give that awareness, bring that allyship, because we know that if we have a great allyship, people sitting there as sponsors and supporting some of this work from an allyship point of view, even actually supporting as mentors, supporting as coaches, will make a big difference. We know that most of the feedback, people would like to see people who look like them being in those senior roles, mentoring and coaching them. But we know that sometimes if you lack that representation, as we see within our region at that senior level, we have to adjust a few things so that we can get that support. But we are doing what we can to get even people from outside of ethnic minority within leadership to see if they can support our program. So we've got that in the pipeline. And that's it. So I've highlighted that this is not in isolation. We've been working with a few organizations, but we keep on sharing this because we know that there's already existing networks to support most of our staff. We cannot do everything. We cannot change the whole world. There are already work that has been happening and staff groups that have already been existing that are supporting. They've created mechanism of support for people from their country of origin. So we signpost people to some of those organizations, and we're happy to share that because I think it's important that when we do this work, it's not done in isolation, is that we actually acknowledge the work that is already happening. We take that information and share it, because I think that's the way that success will be in addressing these inequalities. We can't keep on reinventing the wheel. Where things need to be started, it's co-production or design, we do so. But when things have already been done, we try and adopt those and make them into something that we can adjust within our region. And we've done that. We've looked at Capital Midwife, they've done a program, and we've looked at their program. We've spoken to Midlands, they've done a program. So we are learning from other programs and putting together what we think will be useful for East of England. Thank you.
Tendai, wow. Oh my God, absolutely stunningly awesome presentation. I'm just, oh, if I was next to you, I could hug you. A lot of the things that you said and brought forward just resonated right the way through, just reverberated right the way through me, because one of the reasons that we rebranded the BHM network to Reach for race equality and cultural heritage, you've just sung that theme all the way through your presentation. It's just about inclusivity, that sense of belonging. And also what you said about the talent management. So that was another key theme that came through in our inaugural launch that we had on Thursday, just how people feel in the workplace, staff in key roles, nurses particularly, their experiences, how they feel, and the talent management. And actually, one of our very own, Ruby Lopez, who is one of our cultural ambassadors and who you know very, very well, and who facilitated you being here today, is actually going to be running on, I think it's the 20th of October, 9:30 to 1:30, a whole session actually in supporting BME nurses through the talent management. So there are, you've just highlighted again the gaps, the reasons that they're there, and, you know, the elephant in the room, which is about this institutional racism that we need to get over and work with our allies to tackle. And I'm just delighted to hear of all the things that you're doing. It's amazing. I think you're amazing. I don't know what questions there are in the chat, but I've got a couple, if I can just kick off with those first of all, Tendai, that kind of provoked me. So obviously you've spoken about the inequalities that face BME women when they're actually in hospitals and their experience through labour and immediately post-delivery. And I just wondered, from your mind and in your wealth of experience, we as a trust locally at CUH, at Addenbrooke's, in the Rosie, if there's a woman of BME origin or women right now today, what should we be doing operationally? What should we be implementing, and what are the things that we can sort of think about doing to help those women's experiences be better from the get-go? I'd love to hear your views on that first, if that's all right.
Yeah, so actually saying that, that's a good question. So there was actually some work that was done by all our trusts, and we as well, they sit under local maternity and neonatal systems. And I know the Rosie did that because it was a mandatory ask, because there was reassurance happening during the first wave of COVID. So the 4 actions that all the trusts had to do and especially maternity units. So they had to record ethnicity of every woman that comes in, and especially reduce the unknowns and not stated on ethnicity, because you can't tailor a service if you do not know who you're tailoring it to.
Yes.
So that was work, that was a request from the national team, which is the Maternity Transformation Program, to make sure that that is, you know, that becomes a mandatory, where people are ensuring they ask that question during the antenatal or during the booking. So ethnicity, postcode as well, because we know, as the data shows from Embrace and many other reports, women or birthing people from the most deprived areas suffer one of the worst clinical outcomes. So if we do not know their postcode, again, how do we make sure that we can push services, we can put that specialist midwife to then cater for that community? Or how do we go into that community and speak to that community, find out what are their challenges and how do we support that? So that was one of the things. So they asked for ethnicity, postcode, and many other things, age as well, because we know women over 40 as well, the risk becomes higher when it comes to maternity. Also ensuring that vitamin D and vitamins is encouraged, because again, not lack of sunshine within the country. And part of it was doing a document for tailored communication. So some of the areas did some posters, some went to look at their data, to look at actually inclusive digital. As you can see, that some of the work Cambridge has already done, because actually, how do you make digital inclusive if somebody can't top up their phone and have data? You know, so actually, what other ways can you tailor communication so that you can include other women or birthing people? And part of it as well was a response to COVID. So all the areas had to write a policy in response to COVID, especially focusing on ethnic minorities, because they were not seeking for help, or they were afraid to seek for help, because there was so much social media news and things scaring people that actually the last place they wanted was to go into hospital, because unfortunately people were hearing news that they go into hospital, they never come back. And so there was so much work. So yeah, so that is some of the things that if somebody is to access, there's already things that are in place. And if people are not sure, they can always ask that, you know what, is there something that is focused for me, because I can't understand? And they should be able to provide that. But this has been reassured, and East of England actually did very well on that piece of work.
Yeah, no, that's really reassuring to hear. And if I'm honest with you, I'm not sure, I'm non-clinical, so I'm not exactly sure where we are on some of those pointers that you referenced there. So recording ethnicity, I know we have EPIC as our patient management system at Addenbrooke's. And so I know there's been a lot of movement towards driving recording ethnicity, but I still think it's a voluntary thing. I'm not sure it's mandatory, but I
No.
don't know if that was adopted as a mandatory thing, given the mandate you just referenced there within the
Yeah.
Rosie. But I certainly will be following up on that after
Yeah.
with
Yeah.
our chief nurse and obviously, you know, our divisional heads of nursing, just to see where we are, because I think actually that's really, really interesting. And we should be picking up on those points and driving those forward. And one of the other things, if I could just follow on from that, actually, Tendai, is you've spoken a lot about work that's happening across the region. And as you yourself will know, from Harpreet as well, who supported our launch, Harpreet was one of our keynote speakers. So we saw some of those previous slides that you'd put up there. But actually the integrated care system and integrated care boards is a key factor now and a new movement of how we should be delivering care. So just on that basis, and in terms of the cultural curiosity that you was talking about and your campaign that it's okay to ask, I was just wondering how, so a woman of BME origin comes into the Rosie, she gives birth, but then obviously it's not, we don't just wash our hands of that woman almost at that point in time. What are we doing? And you referenced Signposted and other organizations. And I just wondered, as part of the wider system, what could we be doing at Addenbrooke's and what should we be doing to just make sure we're doing our part and contributing to the experiences of those women within the system?
Yeah, so that's definitely, so as you say, it's okay to ask. It was the reason why Suffolk brought that into, doing that project was because when we did the cultural awareness program, we were running them over 2 hours. And they said, actually, not all of their clinical staff were able to attend them, even though they were so good and so useful, but that was a bit challenging. So they had to do some bite size, like 10 minutes of different, questions that people could ask. But I think from a system level, as you're saying with the ICBs and ICBS, is actually people we're encouraging and actually to work with their health and equality leads at an integrated care system or integrated care board. Because if you do not know who your health and equality lead was in there, how are you? What's the collaboration happening? Are they putting your action plans as part of their actions? And how do you then get support with funding to continue part of this work? All our systems have just submitted through the NHS England their action plans for equity and equality. And it's a 5-year action plan. So they've all submitted and they all had to be signed off at ICB or ICS, at ICB board. So if they didn't get that sign off, they were not able to submit. So they had to be signed off so that they can make sure that their plans will then be taken in and be able to continue being part of the wider system plan.
Yeah.
But one of the things as well we're saying is about reaching out into your community, because it's good to keep on putting plans and assuming what you need for your population, assuming that we need to deliver that. But actually get your community leaders, the lived experience service user, to be part of your Maternity Voices partnership, or reach out to them to just come and share their lived experience, do engagement events. And some of them actually want to work with the units. So I know within Suffolk, they've done, and I think they're spreading as well within Colchester, many other areas. There is what you call the African Communities UK. They've done, so they've got a lady who's a co-founder, Rachel. They've got cultural ambassadors, and they are there to support. So when people call them and say, we got a woman on the unit that needs somebody struggling, is about to have a baby, but needs somebody to keep an eye on their 2-year-old is running around, or needs somebody to sit with them because maybe they're a single parent, or they came out domestic violence or in asylum, or their husband is at work, cannot be released. They need somebody to support them and somebody to just be a buddy with them. They're there. So it's about linking up with existing community groups and seeing how you can invert them, because we know people are busy. There is staffing shortages.
Yeah.
Imagine a woman having somebody that can be a friend at a very difficult time in their life, be able to come into that hospital setting that has already been DBS checked, has already got the safety, done that whole risk assessment, to come and support and be that network during that season or that period of time that woman or birthing people needs it. So they're doing that. So she's got lots of people that she's trained up to do that role, and they're going into settings, going into homes and supporting. So it's about adopting what's already, but one of the things most groups keep on telling us is funding, is they can only do so much with so much kindness, but they need more money towards this. So so I would say reach out to those groups, and the Gypsy and Travelers the same. If you bring somebody from their community to be their support network, they're more likely to engage much better.
So it's true co-production, isn't it? It's that true co-production piece. Tendai, we've got a couple of comments in the chat, so I just want to feed them to you. So Monica Jacko says that actually Monica would like to come on live. So Judith, I don't know if you can hear me. How do we do that and make that happen? I think
I just said we would answer the question live. Monica just wanted to pass on her thanks and say how fantastic the presentation was.
Oh, fantastic. Thank you, Monica. And absolutely it is. And then Ruby Lopez, who's also watching Tendai, she says it's not a question, but she just wanted to highlight that our NICU parent feedback questionnaire was adopted to be more inclusive. So Ruby's just added that comment in there. And thank you very much for that, Ruby. Is there anything in the chat I'm just looking at now?
Erica would like to talk. She's got her hand up, so I'll allow her to talk if that's okay.
Yeah, that's absolutely fine.
Right, I'm unmuted. Oh, hello. Oh, Tendai, that was a beautiful presentation and very comprehensive. This is not a question, it's really a comment and also just a suggestion going forward with the work that is being done across, across the ICS. It's actually good to see individual midwifery and nursing associations that are like country specific, because it's always, there's always a tendency to conflate everyone, thinking that everybody has got the same cultural issues, whether as a caregiver or as a service user. So it's really important to keep growing these individual nursing associations from various countries, so that when we do have that growth of culture ambassadors and we start casting the net wide, we have representation in all these different regions across, from across the world, who would then be called upon should we have issues in the Rosie. I'm a clinician by background and I work closely with the Rosie, and some of the work that you referenced there, Tendai, I did take part in, and it is quite a challenge for people who do not know much about cultures that are seldom seen, to support mothers who are coming into the Rosie to come and give birth in the Rosie. So having more of those individual country specific nurses teams or midwifery teams is actually a good way forward. Yeah. So thank you so much, and thank you for the wonderful presentation.
Thank you again, Erica. Yeah, and I think one of the things, just to add on that, is there is so much support out there, and I think it's just encouraging. One of the things we keep on trying to do as a working group, as keep on heading on our contact list, is actually sharing that information and encouraging as well our leaders to share the information and getting people to share as well those that they. And I'm seeing lots of work as well happening within, because neonates was a bit behind when some of the work we're doing within maternity. and they've actually just feel so empowered. And I've been working very closely with some of your neonatal nurses from actually Peterborough and Hitchinbrook, because they've started their own unit support groups. So they've started ethnic minority staff support, and they're looking at a few things. And I know the Bliss Baby Charity as well. I sit on their working group because we've been making sure that health inequalities is sitting on their agenda when they're doing any work. So they're doing the family integrated care right now, and they're developing and working on that to get units to adopt on that. And again, part of the evaluation will look as what elements of engagement, elements of patient safety and culture, but as well, inequalities as well. So there's a lot of work that is happening. And I think one of the positive things is sometimes things look so slow, like they're not happening. But actually, when you then sit down and start scoping, you then realize, wow, there is work happening. It might not go as fast as we want it to, but it is happening. It's step by step. We are moving forward, I believe.
I think, Tendai, moving forward as an action, I think certainly personally is within the Reach network and the support infrastructure, how we work with the leadership in the organisation to support all of the initiatives. I think, Amelia and I would be keen, together with our EDI colleagues, to just pick up on some of the things that you've referenced. So I'm particularly interested in some of the talent management initiatives that you've spoken about that are happening across other trusts. And I think it'd be really interesting to see, like you said, there's no point in reinventing the wheel. If something's already done and it's happening and it's proved to be successful, perhaps just exploring what we can learn from that. And I'm sure there'll be lots of follow-up discussion and conversation. But we know certainly that, talent management is a real key thing, not just in terms of nursing and obviously within the context of maternity, but across the board for BME staff. As you showed from the res data and your own staff surveys, we're not that different in terms of our metrics. So, this is a real key area for us and something, that we want to focus on. And I think that the work you're doing is absolutely amazing. If I could just pick your brain, I mean, we're running towards the end of the session, and just ask for 3 key things that come to your mind that we as a trust, messages that you'd want us to take home, or direct actions you think we should be focusing our attentions on within the context of your discussion around maternity, neonatal care for BME staff and women. What do you think are the 3 things you would like us to really focus on moving forward?
I always do go back to link to what has been already been highlighted from a national level: the access, the experience, and the outcomes. Because I think if we miss those, because why do women or women or birthing people don't access the maternity services or things that we put in place? Small things like even antenatal classes. The data already highlights sometimes that you don't see ethnic minority attending those classes. Why? Who is doing those? Who is supporting those? So, because they are quite useful, but why is it people don't access? Why is it they don't even know sometimes they exist? And then things like the experience. We know that if people are not happy within a certain services, especially within most community groups, we circulate that information. So if I'm not happy about a certain hospital and the experience I had there, I'm going to tell my sister, I'm going to tell my friend, and they're going to tell their friend. And then that's how the rumor goes around. And we see that in communities, we see that in families. And so the experience is really crucial. Is how do we improve our experiences for our women, our birthing people, and our staff? Because even staff, when it comes to recruitment, you can go and look at certain recruitment, why they are feeling challenged to continue getting staff to come and work for them, or if they do work for them, within 3 months they are leaving. Is what is happening? What is the reason? What is the challenges?
The attrition.
It's because there's an experience that needs to be shifted. There's a culture that's within that organization that people come in and they feel, I don't want to be here. I don't feel safe to be here. I don't feel happy to be here. And I'll tell my friend, don't go and look for a job there. So we need to remember those things. And then the outcomes. if we keep on seeing the same outcomes, same poor outcomes time and time again, why? What is it that we are missing? Why are we not improving? And I think sometimes we scratch the surface. I see that with some of the work I do within, maternity and neonatal safety improvement. We try and just put a sellotape or we put a plaster to see that it might look better, but we come back to 6 months, 1 year, and it's still the same problem. Why?
Yeah.
Let's deep down the root
And
problem.
root it out. Do a deep dive. Yeah.
Definitely. What is it that we are missing that we need to really address? And sometimes it's simple things. Just being able to ask the questions, get the right community groups, ask them what is happening. I think somebody has just put as well, Erica, in the chat as well, faith groups and things like that. But actually, you can only know the faith groups within your community if you do ask the details at the time of booking.
Yes.
Because you won't know most of your faith groups unless you start getting all that information right on the demographics. So I think, to me, I always link it back to that, because if we can't address those three, we can continue creating more things and running away from the reality that we need better access to service, we need better experience, and we need to improve our outcomes. And go deep dive. Why? What is the root problem? Why nothing, things are not changing?
Just honestly amazing feedback, and as Erica said, using the faith groups. And I think Monica also put in the chat, like I said to you, as co-chairing the Race Equality Network, as some actions we will be reflecting on this presentation. And I think there's definitely some follow-up conversation with the very senior leadership in the trust, just looking at our action plan, how we align with the regional strategy, and also the Band 7 job description. I just wonder, Tendai, would you be happy to share that and perhaps share your slides with us so that we could circulate them to anyone who was interested? Because a lot of staff who obviously can't attend because of clinical commitments tend to watch the sessions on catch up. So we would love to, have that information to share, if that's okay with you.
Yeah, so happy to share my slides, happy to share the job description. I think there was also a question as well from Monica about, as well about cultural intelligence. Yes, we're looking into cultural intelligence, but one of the things that we are finding is, trying to get funding to push some of this agenda, because everything needs money. And actually, one of the biggest challenge we've learned is there's money being poured in lots of things, but whenever we start talking about now addressing inequalities and we need funding, it becomes harder. It becomes a much more challenging area to get funding. If we ask for funding for anything else that has nothing to do with inequalities, we probably get funding much sooner. But anytime it comes that, we find that it's become a bit harder. We are getting there. We've already spoken to Above Difference, with the organization that's been doing cultural intelligence and inclusive leadership. So so it's just funding to push that forward for all our senior leaders within maternity and neonates. So
No, that's great. And we are picking up on some of those points as well as a trust. We're picking up on cultural intelligence training for the leadership, and we want to roll that out wider in the organization. But like you say, it's galvanizing the movement, so it's concentrated, and we're doing those deep dives. I think absolutely amazing presentation, Tendai. The most heartfelt thank you for every single thing that you've shared today. I think you're amazing. It's been inspiring to hear the work that you're doing. I'm just so pleased. You were the first speaker for our virtual sessions, and it was the most fabulous of topics. So thank you very, very much. Please do send us the slides and the Band 7 job description. We'll share that across the wider network, and anyone who wants access, basically. I would definitely like for you to come back, and I think there's probably scope, particularly as our regional lead, to perhaps come back and do some follow-up sessions, but we'll pick that up with you offline. I would love to have your engagement moving forward. I think you providing a valuable oversight and a lens that would support us through our journey. So really keen to keep that engagement with you. Thank you to Ruby for obviously facilitating you coming in. And again, just a plug for Ruby's session, actually picking up on the comments you already made regarding talent management. As you've already put the slides on, we know the story. Ruby's doing some really good work to try and tackle that, and is laying on a seminar, as I said, on Thursday the 20th. I'll also just take a couple of seconds to just give a plug for the rest of the programme of events that the Reach Network is putting on for Black History Month. So on Thursday, we have a private screening of The Woman King, where we're taking 50 members of staff to the View Cinema. I think that sold out in literally 5 or 10 minutes, I'm told by Amy Bushen. So thank you to Amy for sorting out the links on Eventbrite for that. But for those of you who are coming, fantastic, see you there. And then on the 17th of October, Dami Collier will be doing a presentation for us on HIV. And then Ranjit Singera will also be doing a presentation for us on the 17th as well on Black health and wellness and inequalities. And then we have our very own non-executive director, Ali Lane Smith, on Wednesday the 19th, doing a presentation on building an inclusive workplace. Friday the 21st of October, Joy Wormington will be doing a presentation for us on wellness in a challenging work environment. And again, concluding on Friday, we'll have Adele Helmy doing a specialist presentation for us on neuroinflammation in traumatic brain injury. We also have Diwali celebrations on Monday the 24th, and on Tuesday the 25th, sort of rounding up the main presentations for the month, will be myself and Emil, with our chairman, Mike Moore, and our director of workforce, David Werrett, just having a casual conversation on the sofa, discussing all of the things that we've seen and heard. And no doubt, Tendai, there'll be comments on your presentation. And then Dr. Sani will be concluding presentations on the 27th of October about COVID myths, facts, and what really happened, and promoting obviously the vaccine program that we've recently just launched. So Tendai, again, a massive thank you for your time, your passion, your commitment to this work. I think what you've done is instrumental, and I've no doubt the legacy will just go on and on. Thank you very much. I'll give you the last closing words.
Thank you very much, Tracy, as well. Thank you for the opportunity to come and share. And I still, I don't take much of the glory, because I think there's been so much passion across our region of, staff members just feeling empowered to say, you know what, now we can do something. I think what we just did was just set the scene to just make it much easier for people to say, it's okay for you to go and do the work. It's okay for you to do this. So I think that to us, that is what we are proud of, is people feel free enough, empowered enough within their system now to actually do something about it, and proud to showcase it as well.
Very much a modest approach. I think you're amazing, and the work you do is amazing. Tendai, many, many thanks. Thank you very much. And thank you to everybody who's logged in and listening now. And to those of you watching on catch up, thank you very much for watching. Thank you very much. I think that concludes the session.